Do you use the single leg squat to work your patient's gluteus maximus? Well, be careful, because the data from this study might make you completely rethink the purpose of this exercise. In a study conducted with 40 people, muscle activation during the single leg squat was measured using surface electromyography, with the results expressed as a percentage of maximum voluntary contraction, that is, as percent MVC. And the results are very clear. The single leg squat is not primarily a gluteus maximus exercise. The most active muscle was the vastus lateralis with 69% MVC. This means that the demand on the lateral quadriceps is very high, so this exercise can be very useful in knee rehabilitation processes, strengthening the lower limb, or advanced training for athletes. In second place is the vastus medialis with 66.6% MVC, practically at the same level as the vastus lateralis. This confirms that the single leg squat places a great demand on the knee extensor mechanism. Therefore, if you are working with a patient with patellofemoral pain, imbalances between the vastus medialis and lateralis, or recovering from a knee injury, this exercise can provide you with very useful information, especially if you use EMG to check whether both muscles are working in a balanced way. The third most active muscle was the gluteus medius with 37.1% MVC, and here lies one of the clinical keys of the exercise. The gluteus medius does not appear as the muscle with the greatest activation, but it does play a fundamental role in stability. During a single leg squat, the body needs to control the pelvis in the frontal plane. If the gluteus medius does not respond well, pelvic drop may occur, there may be an increase in knee valgus and a greater risk of overload or injury. Now then, the most striking finding comes with the gluteus maximus. It only reached 19.5% of MVC. This means that if your main goal is to strengthen the gluteus maximus, the single leg squat probably isn't the best option. The gluteus maximus works especially during hip extension tasks with greater range and load, such as the hip thrust, single leg deadlift, or various hip extension variations. In comparison, the single leg squat demands much more from the quadriceps and pelvic control than from powerful hip extension. A moderate activation of the medial gastrocnemius was also observed, with 20.4% of MVC, mainly related to ankle stabilization and movement control, and a low activation of the adductors, with only 13.3% of MVC. Therefore, if you're looking for a specific exercise for the adductors, the single leg squat wouldn't be the most suitable tool either. What can we apply in clinical practice with this data? Firstly, that the knee takes on a large part of the workload. With the vastus lateralis and vastus medialis above 65% of MVC, we're talking about a demanding exercise for the quadriceps. This can be very useful in advanced phases of rehabilitation, but it may be excessive in the initial stages depending on the condition of the tissue, the pain, and the patient's tolerance. Secondly, that the gluteus maximus requires other exercises if we want to generate significant strength adaptations. And 19.5% of MVC doesn't seem sufficient if the main goal is to strengthen this muscle. And thirdly, that the gluteus medius may be the key to motor control in this pattern. It's not just about isolated strength, but about knowing whether the muscle responds correctly in a functional single leg load situation. This is where electromyography completely changes the way we prescribe exercise. Knowing the average values from a study is useful, but what really matters is understanding what happens in your specific patient. Muscle activation can change depending on technique, depth, speed, fatigue, pain, or the stage of recovery. With EMG, you can check whether the vastus medialis and vastus lateralis are working in balance, verify if the gluteus medius is properly stabilizing the pelvis, and confirm whether the exercise demand is appropriate for the stage of treatment. Because 69% of MVC in the vastus lateralis might be exactly what you need for an advanced patient, or it could be too much if they're in an early stage of recovery. So, is the single leg squat a good exercise? Yes, but it depends on the goal. It's a great exercise for the quadriceps and for pelvic stability, but it shouldn't be considered a primary exercise for the gluteus maximus. The data sums it up very well. 69% of MVC in the vastus lateralis, 66.6% in the vastus medialis, 37.1% in the gluteus medius, and only 19.5% in the gluteus maximus. The conclusion is clear. Use the single leg squat when you want to work the quadriceps, knee control, or pelvic stability. But if your goal is the gluteus maximus, choose exercises that are more specific to hip extension.